Hi, I'm Alan Daniels, Chief of Spine Surgery at Brown University. Today, I'm going to tell you a little bit about Brown Spine and also our Spine Fellowship. Today, I'm going to tell you about our training program and also about Rhode Island. Rhode Island is a great state to visit, lots of sites, very livable place. It's the ocean state. It's 400 years of history and also 400 miles of coastline. They say you're never more than 2 miles from salt water. Lots of outdoor activities to do. Providence is also a great city. It's the Renaissance city. It's the third largest city in New England. It was one of the first cities in the U.S. to declare independence. It's home to 8 hospitals and 5 colleges. It's safe, cheap, close. There's a lot of outdoors activity, and there's basically no traffic. Some people also say it's the best food in the Northeast. Not far away, easy to visit. Newport, Rhode Island, less than an hour. The islands of Nantucket, Block Island, Martha's Vineyard are all short day trips away. Boston, New York are close. And then the northern states, Maine, Vermont, New Hampshire, are short trips as well. Brown University was founded in 1764. It's an Ivy League school, the 7th oldest in the country. Relatively small school of 6,000 undergraduates. It represents all 50 states and 63 countries from students. And we have 37 NCAA D1 varsity teams, which we take care of for their spine conditions. The Alpert Medical School at Brown University is a unique place. It actually has a tremendous history of a school over 100 years old, but they shut down for a long period of time and reopened in 1975. So it's really been a reinvigorated school. It's got a beautiful new campus less than a half mile from Rhode Island Hospital. And like Providence itself, there's been tremendous growth and development just down the street from Rhode Island Hospital. The primary teaching hospital we work at is Lifespan. Lifespan has Rhode Island Hospital, which is a level 1 trauma center, and then the Miriam Hospital, as well as Hasbro Children's Hospital. There's over 1,000 inpatient beds, extremely busy level 1 trauma center. It's the busiest in New England. And the Miriam Hospital is a private community hospital that we do a lot of outpatient community spine surgery. The Kettle Point building is a wonderful place. It has outpatient spine surgery, 6 ORs. There's EOS full body imaging. This is kind of the mothership of where our University Orthopedics practices and state-of-the-art facility. The residency program itself is the 4th oldest in the United States. The fracture service was founded in 1931. Edward Ackelman is a tremendously supportive chair who's been our chair since 2015. The residency itself has 6 residents per year. As most of you probably know, it's a 6-year program, so all trainees do a trauma fellowship. We have fellows in spine, adult recon, hand, Pedi, shoulder, sports, and foot and ankle. The primary Rhode Island Hospital teaching service has a PA, PGY3, and a PGY5 on the service. We do a lot of research. My belief remains that spine fellows really come here to learn spine surgery, but if you want to do research, we've got great NIH-funded research. We're top 5 in the nation for NIH funding with $48 million of supported research and 20,000 square feet of lab space. In terms of the spine service, I am the chief. We also have Dr. Lucas, Robertson, Servian, Kleinhans, Curtis, Bask, Chow, and Everson does PD spine, and then there's 7 PMR docs. It's a true tertiary care referral center. The lion's share of the work remains degenerative, but we do a lot of trauma, a lot of tumor, a lot of infection, and my specialty is deformity, so we do a lot of adult deformity. Also do a lot of pediatric deformity. Spine service is very busy with over 2,000 cases per year. We truly believe in the mentor model. Now, as we've grown, of course, the mentor model is not strictly adhered to. What I mean by that is this practice, when I started, was small. It was 2 surgeons, Dr. Lucas and Dr. Palumbo, and we had a fellow and a resident on the service. So it was a true mentor model. As we've grown, we still believe in that, meaning you will follow these patients from their preoperative care to the operating room and through their postoperative care to learn from them. You will spend some time in the office, of course, to do that. And I truly believe the mentor model is an effective teaching model. With that being said, you've got graduated independence. You are an attending, you have attending privileges. You'll be able to do cases on your own, and we have a true transition to practice model. It's very valuable to be able to take patients to the OR yourself and do the case yourself by the end of the year once you're ready. With that being said, oversight is always available. I strongly believe that fellows should always have supervision if you want it. You will never be on your own. You will have your own private practice, which is very valuable. So you'll see patients in your office, and if you want to book them for surgery, you're welcome to, with or without our attending assistants. You also have trauma call coverage, which in my opinion is not overly arduous. It is a busy place, but each fellow will be on call 1 week per month. We have a full conference schedule, of course. Most importantly, you have a combined orthopedics and neurosurgery conference with Dr. Gokaslan and his team on Mondays. We have our own ortho spine indications conference Tuesdays, and then other conferences throughout the week. As I said, we do a lot of degen work, both cervical and lumbar, a lot of inner body work. Posterior cervical is common for myelopathy, including complex anterior and posterior cervical reconstructions for deformity. We do disc replacements. There's a lot of trauma, as I said, which is a great opportunity for trainees to learn. Thoracolumbar trauma, common high-speed motor vehicle accidents with multiple highways running through the city. We do quite a bit of tumor work, both primary and malignant vertebrectomies. The MIS practice has grown greatly. You know, this is an old lateral, direct lateral interbody case of mine that clearly my partners, Dr. Serving, Kleinhans, and Bask, do a lot more things through tubes and true MIS TLIFs that are far surpass my MIS abilities. Adult deformity, again, is my passion, but is not the complete backbone of the fellowship. If you want to come here and do degen, there's a lot of degen work. But if you're interested in adult deformity, I'll tell you there is nowhere better to be. Do a lot of complex old Harrington rod type revision deformity, sagittal imbalance with PCOs and VCRs. Dr. Curris and I have a real interest in that. This is a spondyloptosis case. The Pedi deformity, usually Craig Eberson does most of it. I do some of the adolescents as they grow up, and then for very complex cases with multi-level vertebrectomies, Dr. Eberson will have one of the adult guys help. We just have been granted an O-arm with stealth navigation and a Mazor robot, so I think that that is attractive to fellows. We will be training you in robotics as well. In terms of research, I did mention the department research, but the division research is also impressive, especially with the addition of Bryce Bask. I would say that our research productivity is probably up with anywhere out there. We've grew from 2014, where we have 23 papers a year, all the way up to 68 on PubMed in 2018. And I'll tell you that we have great research momentum, multiple ongoing trials, including ISSG site for the CADS 10-year follow-up study for deformity patients. Our residents are very interested in spine because we make it look good. We enjoy our jobs. You know, the attending staff tends to be happily married with good work-life balance. Had a lot of residents go into spine, and a lot of residents who have matched very competitive programs, including Emory, Jeff, Pitt, WashU, Colorado, here at Brown, gone on to San Diego with Greg Mundis and his team, as well as Hopkins recently. We enjoy hanging out with each other. We do a lot of social events. We have an annual alumni meeting. There's a golf day. There's graduation celebration every year. We have a Newport Fall Spine Symposium. This was a picture from last weekend where we did that. All got together in Newport on a beautiful sunny day and sat inside going over spine cases, but also had a great social program with it. And lastly, I would just like to thank you again for taking the time to watch the video. I hope you'll contact us with any questions. And you know, there's great momentum with this program, and I would tell you that with all the different benefits, from the attending privileges to the momentum that we have, is a great place to train, and we'd be honored to have you come take a look. Thank you.